very warm welcome to our session on the psychosocial impact of chemotherapy side effects during treatment and beyond. My name is Professor Catherine Patterson. I'm a Professor of Cancer Nursing. I'm in a conjoint position between the University of Canberra and ACT Health based here in Australia. And I'm really thrilled to chair this expert panel here with you today. I have a particular interest in addressing the chemotherapy-induced side effects of alopecia because we understand from the evidence and from a recent systematic review that I was thrilled and honoured to lead is that unfortunately our patients and their families can experience enduring unmet supportive care needs that really move beyond just the physical consequences of cancer and its treatment, but also the profound psychosocial impacts that it has on the individual, but also on their family. So as I say, I'm absolutely thrilled to be chairing this expert panel with you today. Just to kind of set us off in our conversation, as we know through our introductions across our panel, cancer treatment is not just physically challenging, but side effects from chemotherapy such as hair loss can cause really profound negative impacts on psychological health, body image and involvement in managing day-to-day daily life activities. There is a fundamental shift that comes with a cancer diagnosis that can send absolute tidal waves to the person, but also for their family as well, and particularly thinking about young parents who may have young children, how to also navigate those really difficult conversations as well. So what really our conversation here today, which I would really like us to do, is to think about what can be done by clinicians. So thinking about our multidisciplinary team, so that includes doctors, nurses, allied health, psychologists. How can we best support our patients to be treated beyond the physical diagnosis of cancer itself, moving beyond that biomedical model to really think about holistic person-centred care? So I would just like to start off the conversation by thinking about why is supportive care important and why is it really important to meet our patients' needs. And I think there's no other better expert on our panel than Asha to really help us with your insights into what is important and what is most important for nurses and doctors and other allied healthcare professionals to think about.
I think this is a subject I'm especially passionate about because integrative care is so important. It's something that when I was first diagnosed, I honestly didn't think about. You know, you're just like, put your head down, listen to whatever your doctor says and kind of just go through, the motions of it. But in reality, looking back, so many of my fellow survivors and thrivers have all said the same thing, that we wish that there would have been more of a holistic approach to our care. And many of us have felt more like a number, than an actual human. And so I think it's especially important. I always say, I think right next to even like our oncologists in those first meetings, there needs to be like a mental health professional as well, because our mental health takes a huge toll. Many of us are diagnosed with PTSD post-cancer. Many of us are triggered by having to enter those spaces, the oncologist's office, and different, we call it scanxiety, that we end up getting. And so I think it's especially important for clinicians to recognize that each time we walk into your office, it's triggering. I just had an experience recently where I was supposed to get an MRI done for to see if there was any cancer in my brain, just because I was having headaches prolonged. And I think that was it was so triggering. It was more triggering than I thought to enter into those spaces, to smell the saline, the antiseptic and the gloves, like everything, the whole experience was extremely triggering. And having those nurses and doctors that are keen to that, aware of those things, who are saying, hey, we see you as a whole person. We can see that this is not just you coming in for a scan, but you being triggered as you come in for a scan, you feeling it all through your entire body, your spirit, your mind. And so I think it's especially important to recognize that we as patients, we come into your offices and we come as a whole person. We're coming with the baggage of either years of our treatments, or maybe we're coming with no baggage of years of treatments, but a lot of fears of what is to come and what to do next. And we need more holistic approach where you're saying, hey, we're going to consider your mental health as well as your physical health. We're not going to just cure or help you take the cancer away or keep it at bay, but not, take care of your mental health, of your emotional well-being. So I think that is, especially important.
And can I just ask one further prompt? Thank you so much for your insights, Asha. And I think that's why we're collectively here today, is to ensure that we provide those really important conversations to move beyond a number, and we really recognise the person at the heart of our care and our conversations during our consults. When you are coming in to our consult rooms, and you do have those triggers that many other patients will all have, what would have been most useful for you, Asha? What would you have liked, perhaps in your care, to be, as you say, to be recognised as a person in all of that uniqueness that we all even bring around this panel? What would have been most helpful to you, do you think?
I think that addressing it as a whole person, there's different aspects, I guess, to that. I am not only just a breast cancer, I like to say veteran instead of survivor, just my own verbiage. But I think that to see that I'm also a person of color, right? So there's going to be different statistics and different ways that my body will react differently to treatment. When the clinicians actually address that, and say, hey, we see that, you're a person of color. And so when radiation, say, it's not going to turn my skin pink, right? It's not, there was different doctors that have mentioned that to myself. And then actually my mom was diagnosed with breast cancer just last year. And so when I went with her, it was like hearing the whole, spiel again, but with fresh ears. And I sat there going, is this what I heard the first time? Because I don't remember half of it, because your mind is so muddled. And so I think breaking it down for that individual person, seeing each aspect of their lives, because if we're going to be honest here, there's a lot of medical biases, that we can have. There's different biases that we come into because we're all humans, right? So I think that recognizing even that aspect of it, that each person's coming in, different races, different backgrounds, different, even just how much financial burden, that is weighing on their mind. I think recognizing each person and not just, hey, I'm going to cure your cancer and then, let you go, but seeing us as a whole person. I think that's important. I think also setting up, what I would love to see, truthfully, is to see mental health professionals really hand in hand with oncologists, standing right beside them at that first meeting and saying, hey, you can go to 6 sessions, after 6 sessions, if you don't want to go, it's up to you, but making it really mandatory, like making sure that we recognize that our mental health will take a toll. And when I think our oncologist says that, I think we'll listen to it a lot quicker, because we're listening to everything you say, right? We're doing everything that you are asking us to do. So I think you partnering and saying, hey, the way you eat, the way that, your environment, the stresses in your life, your mental health, all of that is important. I would have loved to hear that in the beginning of my treatment, because that was something I had to seek out on my own. And with some oncologists, my first one, they did not appreciate when I talked about naturopathic medicine, when I talked about wanting to integrate that into my care. It was very, they were very standoffish. And so no patient wants to hide, right, the different things they're doing from their oncologist. So I think when the oncologist is open and saying, hey, I don't maybe know about that because I haven't studied that, but, I would love to hear more. I think that approach is a lot easier for then a better patient oncologist, a patient on doctor relationship, because then I'm going to be more open, right, with sharing exactly what I'd like to do and ways that I'd like to go about it.
Thanks so much, Asha. And I think you've raised a really number of important points that I would maybe like to come over to our panel, perhaps Amy, just thinking about how or maybe share your insights, how do you address person-centred care in your clinics, given all of the insights that Asha has been so generous to share with us on our panel? How do you do that? What are the kind of practical insights, please?
Thank you for that important question. And Asha, thank you so much for sharing your perspective. I think I mean, we all learn from our patients every single day in clinic, and just having the opportunity to hear you speak so eloquently about the issues that are of great importance to you and other patients is really important for this discussion. So I have to say, I feel very fortunate. In the center where I work, we place a great emphasis on multidisciplinary care for the whole patient. And when I say multidisciplinary care, and I'm a breast oncologist, by the way, so certainly there's me, there's the radiation oncologist, there's the breast surgeon, that's the key team. But when I say team, I also mean I have a social worker, I have a psychologist, I have a nutritionist, genetic counselor, all these other key members. But it is, anytime I see a new patient, I talk to them about, would you like to meet with my psychology colleague to discuss coping strategies? Would you like to meet with one of our social workers who can really help you decide what type of breast surgery is best for you? Would you like to be referred to one of our supportive care groups? So I feel very fortunate, but I also fully recognize that at many places in the United States and of course around the world, our patients do not have access to these types of services. So I think Asha raises a really important point and something we all need to hear so we can do a better job caring for the whole patient, which is really what you just stated. That's really such a key component of oncology care. And I think it's being recognized given the importance that it needs by the fact that we're even having this panel discussion. And I'd love to hear others' thoughts as well.
I think that very often when patients, there's this new term of the e-patient or the expert patient, right? And I encourage my patients to advocate for themselves, to do their reading, to be educated so that they feel empowered. And very often what happens, in any office is that if the patient comes with information that the doctor or the health professional is maybe not very familiar with, I think there's this kind of inherent bias or like defense mechanism that goes up, and you kind of shut down because you haven't heard this, or you're unfamiliar, you're uncomfortable. And so it's very easy to say, no, that's not what we do. And so I think really when faced with information that is patient-centered, the patient is bringing to you, is to really take a step back and I think really be honest and say, I'm actually not familiar with this, but let's talk about it. Let's go over it. Let me read about it and come back to you, because, realistically, all of our patients are going online. They are connecting. And I think even more so with the pandemic, they're connecting online and they're becoming part of communities, which is wonderful. It gives them more support, and they're sharing stories and they're sharing experiences. And so I personally think it's wonderful if the patient comes back and shares their experience with you. It means that there's a trust that's developed. And I think it's our responsibility as their providers to have an open conversation and to listen. And then, sometimes we may not agree on something. And I think it's okay to put that out there and say, well, this is my perspective. This is your perspective. How do we meet in the middle and come up with something that we are both comfortable with?